Good morning, it's nearly 11 a.m. here in Seoul. I'm Seong at the Arirang News Centre. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus situation here in the country. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation available for you in English. Vice Minister of Health and Welfare Kim Gang-nip will be briefing us on the coronavirus outbreak here in the nation, filling us in on the number of new infection cases seen as of midnight and what kind of efforts the government is making to contain the virus, especially with the spurt of cluster infection cases in the capital area. He's now taken to the podium, so let's listen in on the briefing.
First, we have Mr. Kim Gang-nip with the explanation. Let us now begin our regular briefing for September 16th, Wednesday. As of today midnight, we have 105 new local infections, and among them, in the metropolitan area, we have 81 cases. And for the past 5 straight days, we have two-digit numbers in the metropolitan area. And nationwide and in the metropolitan area, we have the effects of the social distancing yielding, and we were able to contain the virus to a certain extent. However, there are no steep downturn in the virus. Therefore, we need to continue to exert our full efforts to abide by quarantine measures. And as we did so until today, we need to ask all of the members of the public to comply with quarantine measures strictly. As for the residents in the metropolitan area, we ask you to refrain from going outside if they are not essential, and also refrain from visiting multi-use facilities as well. We have experienced the resurgence of the outbreak in the metropolitan area, and the government has also exerted our full efforts to maintain a stable capacity of our medical field. And as for the increase of the patients with severe and critical conditions, there are continued concerns of a lack of critical treatment beds. And we would like to make clear that not all of these critically ill patients are administered at the ICU, and also there are some critically ill patients who are also at just normal hospital beds. And the government is exerting our full efforts to secure more ICUs going forward. And until now, we have been securing these beds for the critically ill patients by the voluntary application by the hospitals. However, now we have switched the means to designate hospitals that will be designated to treating these patients with severe and critical conditions. So we have seen a change in our control scheme. And so far, we have 16 hospitals in the metropolitan area that have been designated, and we have about 64 beds that have been designated. And until the year end, we will also increase this to about 100 going forward. And also we have the designation of the hospitals which will continue to serve to treat these patients with severe or critical conditions. And we aim to have 100 beds for the intensive care beds until the late this year, and until March next year, we also aim to secure about 600 hospital beds for these critically ill patients, so that when we have another resurgence of the virus, we can cope with the virus. And starting from this month, we will be also giving training sessions for nurses who will be designated to serve for the severe or critical conditions, and we have about 250 nurses who will be mobilized as soon as possible, and we are also mobilizing nurses from our military as well. And also we have 15 public national health institutions, and we will also mobilize nurses from these hospitals as well. And we have made sure that we will be increasing their capacity to about 500 going forward, and we will be hiring new nurses going forward. And And as for the hospital beds to treat the severe or critical conditions, we have been able to secure a stable supply of these beds thanks to the sufficient number of life treatment hospitals as well. And we have also sufficient number of rooms for the life treatment centers, which could house about 4,000 patients with light symptoms. And we will also utilize a mobile application to introduce a remote diagnostic application for these patients. And we will be making sure that we have a sufficient supply of the medical capacities and medical equipment and tools, and we will be able to swiftly respond to another resurgence of the virus at any time. And we will be taking a comprehensive analysis of our medical capacity and our quarantine capacity, and we will be adjusting the level of our social distancing going forward. And next, we have some announcements for the coverage of the national health insurance for the COVID-19 testings that are done by the inpatients. And until now, at nursing hospitals and at regular hospitals, all inpatients had to go through the COVID-19 testings, and 50% of the costs have been covered by the national health insurance. And also when the medical professionals deemed when it's necessary, these were also covered by the national health insurance as well. However, we have seen a more need to strengthen our quarantine monitoring for the hospitals with a surge in the number of cases related to these hospitals. And therefore, as for the vulnerable classes which will be adapting to these measures, we will also provide the coverage of the health insurance, and they will be applied until the social distancing measures of level 2 comes to an end. And these will cost about 20,000 Korean won for individuals. And also, as for these people who are subject to this insurance, they will also be eligible to take the test only with 10,000 Korean won at their own expense. So this will help us to track down the patients at an early pace. And recently, the government has also carried out continued diagnostic testings. However, there are some groundless rumors that the government is manipulating the numbers of testings. However, we would like to make things clear once again. We believe that the collections of these samples are taken at about 600 health clinics nationwide and screening clinics nationwide. And aside from the 200 public health centers, the rest are private health clinics, meaning that they are not subject to manipulation by the government. And the diagnostic testings also is carried out by PCR real-time analysis, which is done digitally, and they are carried out at about 150 facilities nationwide. And therefore, it is a very difficult or impossible for the government to manipulate these numbers. And the manipulation is only possible when all of these personnel and facilities comply with the government's measures. So once again, we would like to make sure that manipulation is something that is out of the picture right now. And we would also like to clearly note that we have the upcoming Chuseok holidays in the next 2 weeks, and we have claimed these periods 2 weeks as a special antivirus period, and we are once again recommending the public to stay home safe and sound instead of visiting their hometowns and relatives. And in order to reduce the number of foot traffic, we will be having the fees for the highways and expressways, and this has been also nullified since the 2017. However, it will be also put in place this year in order to contain the spread of the virus nationwide. So once again, we ask for your understanding and cooperation, and we ask you to avoid family meetings during the Chuseok holidays. And as for the revenues that are gathered by these expressways and highways, they will be used for the quarantine aspects for the rest areas on these expressways, and they will be also donated for the use for these quarantine measures. And as for the October 3rd National Foundation Day, we have our plans to crack down on the public rallies. And if rallies are held nationwide, a lot of people could gather in one place, and they will be gathering to have a chant of slogans, and there is higher risks of infections. And so far, in relation to the August 15th Liberation Day rallies, we have seen about 581 confirmed cases in relation to this outbreak, and the virus has spread to about 14 cities and provinces nationwide. And this is why we will take stern response measures to these rallies on October 3rd. So as for the rallies that are hosted with more than 10 attendees, we will be banning these gatherings, and also all of the rallies that have been reported right now will also be banned, and the government will carry out intensive crackdown to disband any of these gatherings, public gatherings and rallies that are held in public plazas. And once again, we will also like to highlight that these groups need to withdraw their plans to hold these planned rallies. And please note that there are many people who are sacrificing their dedications and also their routine daily lives, and thanks for their sacrifice and dedications, we were able to contain the virus to a certain extent. However, we still have many risks of infections, and in order to flatten our curve going forward, we believe that the social distancing measure needs to be abided by going forward. Moreover, the Chuseok holiday is when we have a large movement of people around the nation, and therefore we need to also keep in mind that we need to trace down any potential patients and also carry out intensive quarantine measures. And we continue to ask the members of the public to continue to abide by our quarantine guidelines. And please note that you can be exposed to the virus at any time, at any place. So we ask you to refrain from making non-essential travels or gatherings and refrain from going to crowded places. So at each of your corners of life, we need to carry out your quarantine measures, and we believe that these effects will be maximized going forward, and the government will also exert our full efforts to this end. Thank you very much.
That was a live government briefing you just heard there from Vice Health Minister Kim Gang-ip, updating us on the latest number of coronavirus infection cases here in South Korea. He just told us that there were 113 additional cases of COVID-19, bringing the accumulated total to 22,504. There were, however, no new deaths, meaning that the death toll stands firm at 367. Now, that does it for our coverage of this morning's briefing. We will be back, though, with our regular newscast at midday Korea time with Mark Broom. See you then.